From the station that's on your side, this is Channel 7 News Good Morning Arkansas.
Hey, welcome back into Good Morning Arkansas. Dr. Scott Davis of Baptist Health is here today, and we're talking about statins. A new study came out. We talked about statins before,
Absolutely.
Scott. This is nothing new in terms of what they are, but this study does have some alarming things that they were able to find about statins and cognitive effects on the mind.
Right. It's actually a good finding because here's the thing. Statins have gotten a lot of knocks.
Yeah.
You know, anywhere between, hey, it causes a bunch of muscle aches that may or may not be there versus is there a cognitive memory brain effect?
Yeah.
And so here's how it dates back. So in 2012, based on a post-marketing analysis that had some questionable substantiated evidence, the FDA mandated that all statins in their package insert have a disclaimer that says may impair cognitive ability.
Okay.
All right. So then all the smart folks, like at the Journal of American College of Cardiology and the think tank people, the statin committees, went back and looked at that going, wait a minute, is that really true?
Mm-hmm.
And so there have been several then studies after that. A couple looked at retrospective analysis, so they looked at the data and going, all right, in these studies where we've looked at cholesterol medicines compared to placebo, and they've had these, memory sub-studies, there's really been no impact.
Really?
And then more recently then, as these new injectable medicines, these PCK9 inhibitors, like the Praluent or Repatha, these injectable medicines that lower your cholesterol, they published data earlier this year that said, you know what, we had a sub-study of the memory piece to this, and there's no impact. So then what it led to was then Dr. Neil Stone, who is the chairman of the most recent panel that looked at overall goals for what do you need to be, lowering your cholesterol, what your targets need to be. They then issued a statement that said, look, we've looked at this both retrospectively and then prospectively, and there's really been no memory cognitive impact on statin medication. So it's the whole be careful with Dr. Google, right?
Yeah.
It can
Always,
really
right?
it can be a dangerous thing because you start off on WebMD and then you wander off onto Frank's blog and you get some questionable information. So take-home message is statin medications great for lowering your cholesterol, and there is no objective evidence that there's any kind of memory or cognitive impairment.
Were there any fears among patients that you've talked to about this before this study was published? So this was a real fear, right?
Right. The internet can get some serious steam and get some serious momentum going.
Sure.
And so with all the blogs and all the interactions, then you get the one-off anecdotal kind of, well, I got an aunt that started a cholesterol medicine and boy, she just wasn't thinking right after that. Well, that then led to a series of research done by some Hartford, Connecticut PhD types that then looked at a randomized trial of folks on high-dose cholesterol medicine, atorvastatin, Lipitor, and on placebo, and went through an entire battery of cognitive tests, and there was no difference.
So is the label going to change now?
That's the issue. I mean, this position statement just came out.
Okay.
The FDA can sometimes move like a battleship, so we'll just have
like the NCAA, right?
Exactly.
Yes.
So it's still a government institution,
Yeah.
and so we'll have to see if they retool and rephrase their package insert statement.
Okay, very interesting, and always up to the latest on these studies. And Scott, that's why we bring you in to keep us to the date on this for sure. And so finally, will you be telling your patients that have a concern now, I guess? Will you be telling them, like those ones who had those questions?
Reassure them.
Okay.
You try not to bring it up unless they bring it up.
Okay.
But absolutely. If anybody's worried about that they or a relative has a cognitive issue, it's not because of the cholesterol
And as
medicine.
a cardiologist now, having this behind you, maybe we'll put Dr. Google in the back seat and they'll listen to you
Well, you always encourage folks to get more information.
Sure,
More information is a good thing.
Second opinion.
Yeah, absolutely. Yeah. But make sure it's educated and be careful not to wander off into the internet weeds.
Yes, and always more studies are being done every hour, every minute, and that's what Scott and the folks do over there at Baptist Health. They stay up to date with these studies so they can keep you informed and keep you healthy and keep on amazing. Once again, here's the Baptist Health information. You can always call the number on your screen or go to Baptist-Health.com. If you'd like to set up an appointment, you can always call or go to the website to do that. Scott, we always appreciate you coming in, buddy. Thank you.
Good to see you, Chris.
We'll see you next time.